How many people read through other people's posts about how they like to study? Good. Any good tips? Any ones that you read through and said like, "Wow, that's a great idea. I think I'll do that." I read through all of them, and I thought there were a lot of great tips. I thought there were some people that are a little lost on how to study. Did anybody feel lost on how to study? A little bit initially, okay. And each class will be a little different. Um, there's a bunch of different types of learners. Anybody a really artistic person know that they are an artistic person? Wouldn't be in PTA if you would, you'd be in OT probably, right? Um, I have a friend who she was an art major for undergrad and then went to grad school, and all of her notes were drawings. That's all she did. Her studying method was drawing. Her notes were incredible. Um, I could not do that. I I think there are some classes that lend more to certain styles than others. I think your anatomy is a lot of visual, right? You got to look at the structure and know what the structure is. If you know what the structure is and where it starts and ends, you can kind of start piecing things together. I think your kinesiology is more movement oriented. And if you can get up and move your arm as you're studying it, things start to make sense a little bit more. This class is a little tough because there doesn't seem to be like one method that definitely works. So I want to go through a few things, and hopefully we can come up with some ways we can improve ourselves. So I'm spending a lot of time on this because I have a lot of students that just don't know how. We have a lot of people that have had a big gap in between their last schooling, whether it was high school or some college, and now, and that can be intimidating. And some people haven't had any success in other methods and just don't know how to get better. If you feel like you're getting stuck, where can you go for help? The Success Center. I think they renamed it the Tutoring Center, but yes, the Success Center or Tutoring Center. That's an easy stop. They have online appointments, in-person appointments, people on every single campus. How many people live near a campus that's not here? What do we have? Lincoln, Warwick, Newport. Is there one in West Philly? I always forget that. I always think there is, and then I think there isn't. So anyway, so you can go to your closer campus. It doesn't have to be Providence. Their hours are really widespread, really accommodating, and they also have weekend and really late times as well. So you can easily access the tutoring center or student success center. You can always ask me if you need help too. Okay, I am here for you. Especially today, I got here early. I'm always willing to stay late after class if you have a problem with either this class or something else in your studies. I might be able to point you in the right direction. So, but let me show you how I think about studying, how I organize my studying process, and then a couple of tips and tricks along the way to make it efficient for you. Because I think one of the things I think I read on 4 different people's posts how busy they were. Work, kids, other classes. Does anybody feel really busy and that they just don't have a lot of time? I think that's a lot of people, right? So I told you that the textbook requirements or suggestions should be that you'd spend at least 2 hours of studying outside of class for every 1 hour in class. And man, that just, even when I worked part-time in college, that still didn't seem like it could happen. So I want to find a way that's the most efficient for you. And maybe we can take that 2 hour chunk of time and we can condense that so it's a little bit shorter for you. I think each class is a little different too. Your anatomies, you got to put in the time. There's really no magic to that. But let me show you what I like to do. So, does anybody know what my first step is? I'd mentioned this before. It's like third step, but review is important. It sounds similar to review. Skim or preview. So my whole thought process is learning is reps. Some things are going to take 1 or 2 reps. Other things are going to take a bunch of reps. How do we get a bunch of reps with not a lot of time, though, and enough variety of ways that you get you just create those new memories? So the first rep is a preview. You should be coming into class. What are we going to talk about today in class after I'm done rambling about how to study? PTA versus PT. Anything in particular we'll talk about with that? Say that again. Different roles of their jobs. Great, great. So you know what to expect. Did anybody come in here not knowing what to expect? I'm just going to show up and Josh will ramble for almost 2 hours and then I'll go home. We'll get Josh sidetracked about the newest Taylor Swift news. Or, by the way, she can do better than Kelsey, right? Right here. Anyway, so we should be previewing, but that's all it should be, is a preview or a skim. A skim, yeah, just a quick review, quick look. There's a few different ways I think you can do that. You could glance at the PowerPoints or other material that your instructors post on Blackboard. Does anybody have an instructor that they have Blackboard, but they don't put anything there, or their Blackboard is so disorganized that you can't even make ends, right? So I think for my class, well, here's the problem with my class. I think I posted this weekend. Did I post this week's? I'll tell you what, next week's I'm going to post Wednesday. Like I've got to work on it for the whole week and then I've got to post it. So even with my class, like it's pretty organized, but you might get the material late. But I see some head nods of other professors. It's either disorganized or not there. All right, so it's not there for us. Okay, that's okay. We have a couple other things. Some other things, old videos. Did anybody have any instructors that have old videos of their classes or lectures or anything like that? Yeah, some. Okay, so if you want to just put those on in the background while you're cutting the grass, while you're fixing the pipes, while you're, whatever it might be, put it on 1.5 speed just to kind of just start to hear that message. Nothing crazy, just a little preview, right? Here's the other way. Here's the other thing, textbook. Now here's what I would do for the textbook. So we're covering chapter 3 today. All I would do, we could make this 2 separate reps, or we could make this just 1 rep. Again, you got to figure out what's best for you and the complexity of the class and what kind of grade you want in the class, right? I mean, the PTA program is challenging to get into, so every single grade does matter. But there are some classes that don't matter as much. So here's my first skim. I'm going to look at the textbook. This is the chapter, PTA. Just glancing at the big words. All right, a couple of pictures here. Maybe I'll stop on. Anybody like pictures like me? I like pictures. So you glance at the pictures. Okay, on employment and salary ranges. Okay, good. We'll probably learn some evolution. Okay. So I'm just glancing, just seeing if anything catches my eye, getting a feel of it. All right, so that's our rep. Now, if your professor isn't, how can I word this? If you don't click with your professor, if their teaching style doesn't match with your learning style, is that an okay way to everybody know what I'm talking about? Okay. You probably have to do a little bit more preview for that kind of a situation. So what I would then do, you see every bold word, right? Definitions of characteristics, history, and role, development, maybe these ones, origin, evolution. Okay. Those things I would grab in your notebook or digital, however you like to take notes. All of those headings I would make into questions. What is the education and curriculum of the PTA? What are the curricular standards? All right. So, and I would stop there. I would go through the chapter. And then at the end, I'm probably going to have 15 to 20 different questions written down. Why did anybody want to think of why I did that? And I would stop there. So this is another individual variation. I wouldn't read the chapter ahead of time. I would wait for my instructor to teach me. But I would go to class with my list of questions that I got from the textbook. And as I'm listening for the answers to those questions. So there's a couple reasons. Now, if anybody has, the reason I say I wouldn't read it is just because I don't have enough time to read every single chapter of every single class I'm taking. If you have the time for that, you're only helping yourself. But does anybody sound like that's unrealistic for the amount of time that you have? And has anybody ever tried to read a textbook? Are they the most well-written, entertaining things to read? No, they are. Who's read a textbook? Because this happens to me even when I'm trying to create content for the class. You read a textbook and you read the same paragraph 5 or 6 times in a row, and then you realize you did that and you go, and I have to do that again because I still don't know what I read, right? So that's why I refrain from reading textbooks. If you've got time, if you're good at reading textbooks, I'm not. I find a bird flying in the sky to pay attention to. I do not have the attention span to read a textbook. But if I want a good grade and I have a professor that doesn't click with my learning style, I might have to. But with those questions, I get to do the next step. What's the next step? The biggest rep that you can have. What are we doing right now? Where are you listening, though? We go to class, right? There you go. Biggest rep you can have is go to class. Who nods off when we're in class? Not this class because I'm so damn entertaining, but other classes, how many people are sitting there and going like, holy cow, I just faded out for a little while. Right? So hopefully there's less opportunity to do that because you're listening for the answers to your questions. You have a reason to pay attention now. Instead of just somebody blabbing up here about who knows what, you have a reason to pay attention and you get to jot down the answers. Now, the other reason I wouldn't read the textbook is because I think in this chapter, there's, I don't know, 20 to 40% of the chapter that we just don't need to cover. It's not that important. I don't think it's going to make a big deal. So to save your time, you're reading stuff that we're not really going to get in depth on. You want to get a great grade and you have the time, go for it. That's only going to help you. But again, I'm talking about the most time efficient way. You've got to figure out how it's best for you. I can't do that for you. This is just my idea. Do you have a question?
Chapter 3 is very much covered in the first chapter.
Yeah, we covered a lot of it. Yeah. Yep. Yeah, and we're going to cover it again. Yeah. Yep. All right, so that's your biggest rep. Here's the other reason why going to class really matters. With your list of questions, there's something that was explained but you didn't understand. You get to ask questions and clarify. So if you didn't do this preview step, it kind of all doesn't make sense, at least initially. But when you have a list of questions and you're listening to the answers, the ones that don't make sense to you, you can clarify. The things you skipped or the professor skipped, you get to say, is it important for us to know? And then they get to say yes or no, right? So that's one of the other reasons why going to class is the biggest rep. All right, next up after that, See if I can get a better camera angle. After class, what do we do? Review. So this step also has a lot of variation to it. This step can be as simple as we drive home tonight, what did we learn? What were the major things we're going to remember, found interesting, or found challenging? If you could remember what was interesting and what was challenging, then you've got a good place. But yeah, just review. So it could be on the way home. It could be tomorrow morning you glance at it, right? So it it can take a lot of different forms. You might just rewrite your notes. Anybody have really sloppy notes that you want to rewrite, right? So you're not really like spending a ton of time, but you're just kind of writing it so it's a little bit more legible. That could count as a review, not a ton of time. But this can be as simple as, like I said, how many people have, do you think, knowing we've been together for, this is our third week, so in the last 2 weeks, do you think if you drove home and thought about class for 20 minutes, you'd cover the bulk of the material, the big highlights of the material each week? I think 20 minutes of driving home thinking, okay, if we took out all of the times Josh says, if he got just took out all the time he got distracted of talking about his favorite pop star. Yeah, I think 20 minutes is probably a good chunk of time to say, to at least come up with what did I learn the most about or was interesting and what was the most challenging. If you come up with those two items, there might be multiple items, but those two questions, answer those two questions for yourself, you have great ground for the next step. For your active study session. I'll say this, I don't find it applicable, but I'll say this. Research says your study time should be limited to an hour chunk. I think that's great research advice. How many people know that they just have 3 hours on Sunday to study and that's it? Right. So sometimes like research doesn't fit with life. And if your kids are, the best time for me to get work done is when my daughter takes a nap and my son is watching TV and on Saturday and Sunday from 12:30 to 2:30. The house is quiet. I don't have dishes to do. I don't have laundry to do. I don't have kids to do anything with. Like that is the time. So if that's the time that fits in my schedule, who did I say remind me of scheduling? I said that. All right. I need you guys to remind me about scheduling after I'm done with this, okay? All right. So if that's all the time you got, guess what? You got 2 hours, you got to use them. You got 3 hours, you got to use them. So research will say 1 hour chunks. I think that chunk of time, if you have 2 hours, study 50 minutes, go take a walk for 10 minutes, then hit the last hour. Like that counts a little bit. But what do we do with our active study session? And I call it active study session for a very important reason. When I read a lot of all of your posts, I saw a big variety between active and passive. If we are active with our studying, we're going to make memories faster than if we are passive. What do you think? Let's just come up with some categories, active versus passive. Let's write it over here. What are some, you guys said you read through the posts. What are some methods that were, let's start with passive. What's a passive studying method? Rereading notes. I'd say that's somewhat active, but if you're not doing anything with it, I think it's low level active. How about listening to the lectures? I think rereading can count. I know when I reread either textbooks or notes, it becomes passive for me because I stop paying attention. Some of you that are more attentive can read and get things out of it. So I will warn you that it can easily turn into passive. What else do you think? Any other passive
read things to, explaining it to them.
I think teaching someone else is the fastest way to learn something. I don't care if it's a loved one at the dinner table, kids, pets. How many people talk to their dogs, goldfish, iguanas, or whatever pets you have? How many people do that? You teach your dog anatomy. Teach your cat anatomy. And you guys using cat cadavers? Yeah, teach your cat. Yeah, they do. I think that's the best method you can do. Other things you can do, and I'll just leave this broadly. Create. Anything you create is better. I'm a charts and tables guy. If I can come up with a chart, PT, actually you'll see it when in my PowerPoint. PT, PTA, education, salary, age, whatever other demographics. If I can create this table, it makes sense to me. If you're not a chart person, then you look at it and say, okay, that's a chart. And that's what you're going to see in a little bit. What are some other things that we saw in our posts that we were creating? Who's my flashcard person? Who wrote that they love flashcards? Right? We're creating, right? So here's the thing. If you created 1,000 flashcards about every single fact you could ever learn, could you just give it to her and she could learn everything? Why doesn't someone else's flashcards work? You got to create it, right? So creating the flashcards is the most valuable rep. Using the flashcards is great, but the most valuable rep is the actual creation of the flashcard. Does that make sense? So what I will say, using those flashcards later, I love because they become what I call travel tasks. Anybody wait in line at a coffee shop for 10 minutes today? How about, or a bakery, or baker's going today? Anybody? How about while you're getting an oil change, maybe? Anybody wait around today for anything? Sandwich at the sandwich shop, right? So I love the things like travel tasks and Quizlets I view Quizlets the same as flashcards because this valuable step is creating it, but then using it is good. And it becomes a travel task where you're waiting for your sandwich to get made. You can pop that up and you can study for 5 minutes. So I would put those in a looking category. Looking can be active if you're really paying attention to it. It can become passive if you're not really focused on it. And if you're like me and you lose focus easily, especially on topics that can be challenging or dense, have you ever you're good at flashcards, so probably not you, but have you ever just realized you flipped through 10 flashcards and you haven't actually read a single one? How many of us that aren't great with flashcards have done that though? Right? So that's what I mean about that becoming passive. It's not really sinking in, not for you because you like it, right? That's how you like to learn. So whatever you can create, flashcards, new notes, Quizlets. Now, here's the other thing about flashcards that I think I wrote to you. When you can make both sides of a flashcard a question, they're going to create a memory faster than if one side has the answer. because then you can just flip the card over and read the other question. There's something about, and I had someone who's really smart and knows way more about learning than me explain it to me, and I said, oh, okay, and then I didn't understand it. So there's something about when we are asked to answer a question that creates a memory faster than just reading the answer. So if you, one side of the flashcard, who performs examinations in physical therapy? The physical therapist can perform what aspects of patient-client management model? Like making both sides of question will enhance your ability to use those flashcards. Test it out and tell me next week if you like that, okay? Any other ways that we like to be active and create? Any did I miss? Who said mnemonics? Somebody said mnemonics. All right. So if you like mnemonics, you're creating something, right? That counts. Songs and dances. I think songs and dances actually are a good way to do it, especially in our movement-oriented classes like kinesiology. I think dances and things like that can really work. I mean, I'm a great dancer, but I have trouble learning with dancing. So again, like you've got to just find the style that does work for you. But I'm telling you, previewing 5 to 15 minutes, guess what? You should be in class anyway. And if you did a good job previewing, that's going to make that time more valuable. Reviewing as little as 15 to 20 minutes. Your active study, roughly an hour to 2 a week, where you're creating something. Now, the next step is to test yourself. What resources can we use to test ourselves? Potentially. Anything else? What's that? The objectives. If you look at the objectives and you can answer, you make those into a question and you can answer them, you've done a great job. If there's 1 or 2 objectives that you're fuzzy on, you know what to study with, you know what to tackle, right? Now, I've got a couple other things for your active study session. I want to write this down. All right, so 3 things I would like to say about your active study session. I think study groups work. In my 10-year career, when I see the students who form groups, they always perform better than not. So if you're struggling with something, 1, go to the Tutoring Student Success Center. 2, find your way to a study group, because it definitely works. Because ultimately, at some point in a study group, what are you going to end up doing with one another? Either in a pair or in a bigger group. You're going to be testing each other. You're also going to be doing what? Teaching each other, right? So, I mean, you're going to get the best of all worlds if you're in a study group. So groups, I would highly suggest, especially for your more difficult classes. How come we're all here at 5:30 on Thursdays? How do we magically get here? Not like physically, I took my car and I drove on the highway, but like, why are we all here at 5:30? You chose the time. It's in our schedule, right? You should do the same thing, especially if we're busy. Schedule your study sessions and hold yourself accountable to that. Like I said, if I had to learn something between 12:30 and 2:30, Saturdays and Sundays, the world is shut off, and I've scheduled that in my phone, and I'm going to have an alarm saying it's 12:30, it's time to study. I'm going to hold myself accountable to that. If we don't, it can always become a I'll do it later thing. Now, I'll tell you about one student that was really struggling in intro. This is 2 years ago. Really struggling after midterm. And I just said, Bud, what's going on? He's in my PTA program now. So he fixed his problems. but he was really struggling. I said, listen, something's wrong. Go to the Student Success Center, talk with them a while, and see if you can figure it out. He came back to me, and all week long, he thought, I'll study over the weekend. I'll study over the weekend. He works at a restaurant, and he does doubles Saturday and Sunday. Guess when the least amount of time he had to study was? The weekend, right? So he kept thinking on Wednesday, I'll tackle that on the weekend. I'll tackle that on the weekend. He's working all weekend. He's not tackling anything, right? So it wasn't until he sat down with his weekly schedule and he planned out Tuesdays, I study anatomy, Wednesdays, I study PTA 1, right? Whatever it might be. Like, so if you're having trouble maintaining that, put it in your calendar. The last thing I have for you is chunking your time. So kind of a weird word, but it helps you. I don't know why it sticks in my brain. When you do your review, what did I ask? I have 2 questions you should ask yourself. What were the 2? When you're reviewing, drive home tonight, 20 minutes. You guys, so when I say, do you guys ever nod off in class and nobody says, yeah, I do? Like, that's, yeah, you're full of it. I asked you, what did you find most interesting? And then what is the most challenging? When you sit down to study, what do you start with? The most challenging. Start with don't start on slide 1 of the PowerPoint or page 1 of the chapter. Based on your good preview going to class and review, the hardest thing about this week was this part. I'm going to start there. Why do you think that's the most important thing, to start with the hardest? We're going to study for an hour or 2. Stays in your brain longer. We got more time with it. So it's like, you know, my daughter's waking up at 2:30. If I start on the hardest thing at 2:15, I've only got 15 minutes with it. So if I start at the beginning, I got a ton of time with it. Yeah, good. Anything else? That's it. Less tired. We're always at our best earlier on in our study. So yeah, start with the hardest thing. Don't start on the first item of anatomy. Start with the thing that you thought was the hardest. Tackle that. And then when you start getting tired or you're kind of squeezing the last couple minutes in, do the easy stuff. One other thing that I see is occasionally when I say be active and create something, I had a student just this week show me their study guide. I'm giving an exam on Tuesday in one of my classes, and he showed me his study guide, and his study guide was cut and pasting from my PowerPoints all into one big document. What do you guys think of that? You think it's confusing? Yeah. 100%. Rewording it to your words so that you understand it is definitely what you have to do. But what did he do? Yeah. For this class or all your classes? Okay. Yep. Yep. Hmm. Okay. Yeah. 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 Yep. That's good. Here's my criticism of that. I like how you're organizing, and I think when you go back later to study, that's going to really help you. But did you actually create something, or did you just organize something? So if we're going to put it, and it's not perfectly either one, but if we're going to put it on the spectrum of active versus passive, is cutting and pasting electronically, does it lean towards passive or lean towards active? It definitely leans towards passive. And that's okay. There's a time and a place for passive. Wait in the line at the sandwich shop is time for passive, right? You can't say, yeah, meatballs and give me a second. I want to study for it half an hour. Yeah, toast it. Like, no, you like there's a time for passive, but um you shouldn't only be doing passive, and don't trick yourself thinking you're studying and really you're just being passive. Yeah. Perfect. So now you're taking over to active. Yeah. But if you were just to cut and paste, all right, you spent a lot of time cutting and pasting, spent a lot of time staring at your screen. I'm not sure you actually studied. And again, not you, but my other student that showed me this week. So, all right, is any of this confusing? Do you think any of this you're going to start to implement and be successful? I hope you do, and if you find anything that really works, let me know. I had one student just came up to me and said, "Josh, thank you so much. My math class is so much better because of this." And I was like, "Well, that's flipping awesome. I mean, I care about my class. I don't really care about your math, but I like you're succeeding. So let me know if that does help. Let me know. All right, let's fire up the old PowerPoint. All right, PTA versus PT, how we got there, what the roles are. So the roles of PT start, I think the easiest place to think of it is starting with direct patient care. There are 3 levels of patient care. Most of what we see, who works in a clinic right now? Who works in a PT clinic? Any techs? You do? Because you said, geez, I have 4 hours a week that I'm not doing anything with. I love it. I'm only laughing because you are there's some special people in the world that hate sleep, and I think you're one of them. um Most patient care in the physical therapy world are provided, it's called secondary care. Patient was referred to a clinician, hey, go see physical therapy, they're down the street, they're up the second floor, something like that. There is primary care. So a member of the healthcare system is responsible for the majority of healthcare needs of the individual. It's rare for PT, but there's a growing prevalence of the physical therapist is the primary healthcare source for some patients. I think there's some good and bad to that if I'm going to be critical of our profession. I have some friends who think it's great and do a great job with it. I think it really depends on the patient. Young, no other disease states, the patient young and otherwise healthy. Yeah, I think physical therapists could be a great for, I think anybody in this room would probably fit under, PT would be the primary healthcare worker for that person. Tertiary care is care provided by specialists, commonly in facilities that focus on a particular health concern. Sometimes this happens really with specialized conditions, Parkinson's disease, spinal cord injury, traumatic brain injury. That's what SCI and TBI, spinal cord injury, or traumatic brain injuries. That could fall under tertiary care. Other roles, prevention and wellness. Prevention and wellness has exploded in the physical therapy world over the last 15 years, and that's a very good thing. What was the third outcome of any physical therapy encounter? The first one is improve current level of function. The hopeful is return to prior level of function. And then the last one was what? Prevent future problems, right? So yes, I think prevention and wellness is a wonderful role for both physical therapists and physical therapist assistants to fulfill. So the extensive education and training can promote healthy behaviors, prevent or limit dysfunction. And like I said, it's really expanded recently. Other roles, consultation, providing an expert opinion or advice. Only physical therapists can do that. Education, formal academic teaching, or community education. So both PTs or PTAs could do that. Research, critical inquiry, both PTs and PTAs did that. And I think in the video we watched week 1, there was one therapist working with someone with prosthetics who said, "Oh, I'm a clinical researcher. I'm research based." So, but I know of one PTA that most of her role is within research. And then administration, clinic manager, facility manager, climbing up to CEO of the healthcare system, whatever it might be. Both PTs and PTAs could do that. So both PTs and PTAs have to practice within their scope of practice. That is something that is really important to understand what the scope of practice is and how do we stay within it. You know, as a physical therapist, I've had tremendous amount of schooling. I took human cadaver anatomy, treated patients after surgeries. Does anybody want me operating on their ACL? Guys answered that a little too quickly. But I agree. No, I don't have the training. And most importantly, it's outside of my scope of practice. I don't know. I don't know if you want to Frankenstein volunteer yourself. So the scope of practice is influenced by federal laws, state laws. Now you're going to hear me say this term over and over again called Practice Act. That is a group of state laws that governs what that profession can do within that state. There are differences state to state. In Rhode Island, I can do spinal manipulations and dry needling. In California, I can't do spinal manipulations. I am unsure about dry needling. I'm leaning towards no, but that's just off the top of my head. I could be wrong on that. And it's up to me to know if I'm moving to California, I got to know what I can and can't do. And also professional guidance and personal abilities. Now, here's the other thing about personal abilities is another great thing. So just because in Rhode Island I can do dry needling, I don't. I've never taken a class in it. I've never had any sort of certification in it. Nobody's ever taught me how to do it. There would just be me jamming needles into bodies and hoping that it works. So yes, even though legally I could do it, I have no experience or no training in it, which means if something were to go wrong, no, I'm on the hook. Like I'm not a trained professional. So PTs are responsible for all evaluations, initial reassessment and discharge evaluations. That is the legal definition of physical therapists within the scope of within physical therapy. PTs responsible for all evaluations. Highlight that, underline it, star it. PTAs can execute treatments within the scope of practice, within their scope of practice. Dry needling, no state allows a PTA to do dry needling. Wound debridement with sharps. I think we talked about this earlier, but what does wound debridement mean? Cleaning, more specifically. In the wound world, cleaning, it means something very different than debriding, but you're on the right track. It's a good category. Debriding means removal of dead tissue. The reason why I want to remove it is because that dead tissue blocks healing from taking place. So sharps are scalpels and tweezers. Physical therapists can, in Rhode Island, can do wound care with sharps. PTAs cannot. Now, again, that's one of those things. I've never had training on it. I can't run into the hospital and say, "Oh, you got a wound? Don't worry, I'll be right back with the scalpel." No. Even though it's legal for me to do it, I do not have the skill to do it. Now, PTAs can do wound debridement, but we call it non-selective techniques, where we get to squirt water into a wound and remove dead tissue that way, like a little super soaker we get to use. Something else we can use is wet to dry dressing changes. So we take a gauze, we'd wet it with saline or maybe some sort of medicated solution. We put it on a wound and let it dry. What do you think we do next? Yeah, that's good. We rip it off, and any dead tissue and some live good tissue is going to come off with it. So we could do that. What do you think about what do your patients think of you after you do that? I will say most of the time, those type of wounds, they lack so much sensation that there's usually not a problem. But yeah, every now and again, you'll get a few words thrown at you. And spinal manipulations are another example. Physical therapy assistants cannot perform those in this state, even though physical therapists can. So we did talk about this before. You guys remember this picture, right? So this is how the patient interacts with physical therapy. Starts with the examination. Examination, who performs it? The PTs. And that is, my analogy is taking the puzzle and dumping it out on the table. And we get to put the edges over here, the blue puzzle pieces over here, the green ones over here, and it's just a bunch of data. That data includes, those puzzle pieces include, where does the patient live? What was the prior level of function? How young are they? Any other medications? Like any piece of information that might matter just gets dumped out on the table. The evaluation is putting all those pieces of the puzzle together. Who does that? And by legal definition, right? So anytime in your curriculum in the PTA world, if you see evaluation, that means the physical therapist is doing it. It doesn't matter if there's other words attached to it. Reevaluation, discharge, it doesn't matter. Evaluation means PT. So that's putting those pieces of the puzzle together. Some things are going to matter a whole lot. Other things aren't going to matter at all. Diagnosis, that's the physical therapy diagnosis. Again, we're not really diagnosing conditions or diseases. We can give insight to our medical colleagues. There's plenty of times I called a doc up and said, "Doc, I think this person has torn ACL, torn ATFL." What's the ATFL again? Yeah. Yeah, anterior talofibular ligament. And why do we learn that? What was so unique about that? Ankle sprains is the diagnosis, that the condition that we learned it with, and what is so unique about the ATFL? Most commonly sprained ligament in the body. Yep, good. So there are times when I call my medical colleagues and say, "I really think this person ruptured this ligament, tore this Achilles. I think they are having a stroke. I think this is not a shoulder problem, but there's some sort of neuromuscular disease problem with this." Like those things I can give my insights into, but I'm not diagnosing anything. That's not my role. The physical therapy diagnosis is the consequences of that disorder. Because of your cardiovascular condition, heart attack, you have limited endurance. Because of your ankle sprain, you have limited mobility, right? So it's the consequences of the problem rather than diagnosing the problem itself. Prognosis, there were a couple of elements in the prognosis. First of all, who gets to write up the prognosis? Whose job is that? PT again, yep. All right, so there's a couple elements. Who can remember the elements of the prognosis? Plan of care is usually involved in plan of care. Now, whenever I talk about it, plan of care is so important that I talk about plan of care almost separately than from prognosis. So the plan of care, we use the analogy, it's the recipe, right? It's how we're going to try to get this person functioning better. And your job as the skilled clinical-based problem solver is to take that recipe and know when we need to do more of one thing, less of another. You're going to remeasure things along the way to help you make those determinations. Week 1 of an ankle sprain, we're probably going to control swelling a heck of a lot. Week 3 after an ankle sprain, what do you think? We're doing completely different things because swelling should have subsided by now. It should have, for the large part, gotten out of the way by now. So you as a clinical-based problem solver get to say, okay, we're not going to do as much of this. We're going to do more of this part of treatment. And then you know what? Your patient's going to go for it. It's going to be doing great, and they're going to go for a hike, and they're going to come back with a ankle that's more swollen than the last time you saw them. What will you then do as the clinical-based problem solver? Either reassess, remeasure. What else would you do, you think? Try to get the swelling down. Yeah, let's fix the swelling. Hey, swelling hasn't been a problem for a little bit. It's a little bit worse today. Guess what? We're going to back off on over here. We're going to add more of this swelling type treatment over there. Just like when what did we learn? Baking cookies in the humidity. Was that week 1? What was the thing that she had to put it? She had to put it in the freezer right away, or something, or else what did she say? It got tacky or something. It's things I would never consider, right? But that's what you guys will eventually be doing. You'll be able to play within the plan of care. You can't say, "Oh, you went for a hike and you fell and hurt your wrist. Let's start working on your wrist." No, no, no. The wrist isn't in the plan of care. You can't touch that wrist because the wrist needs an evaluation, and who does the evaluation? PT, right? But if it's just about that ankle sprain, you can work on just that ankle sprain. You can make those adjustments in the ankles. Hey, today's a rough day. I'm going to do a little bit over here, a little bit more over there. Today's a great day. We're going to do more of this other stuff. That's what you get to do. You get to operate within that plan of care. But the PT develops the plan of care. Other things in the prognosis is how much time is it going to take? How many visits a week potentially? And then what their optimum level of function will ultimately be. That'll be part of the decision making for that PT. Again, not everybody returns to prior level of function, and I also don't think we have to get our patients to 100% of return of prior level of function. I think a lot of times we got to get them 80, 85% of the way there, and then we say, call me if you don't have problems. Like, you can get the rest of the way on your own. That's a very patient-specific decision that we've got to make, but I think that's reasonable. All right, and then interventions and what comes along with interventions. First of all, who gets to do it? PTs and PTAs now get to do it, right? So, and the interventions are going to follow the plan of care. And it includes things like remeasuring problems, monitoring progress, making decisions about what should we change for today's visit based, still operating within the plan of care and your scope of practice. All right, you guys did a really nice job with that. So I'm going to kind of quickly go through this stuff. Examination done by the PT, again, that's all those puzzle pieces together. Includes things like history of the patient, PMH. Anybody know what that means? Prior medical history, family history, CC, chief complaint, MOI. Mechanism of injury or mechanism of illness, depending if it's not always a physical injury. So good. Systems review, looking at every single system of the body. You guys taking anatomy right now. Have you moved past cells? No. Just starting to go into tissues. So integumentary will be the kind of first system that you'll tackle. And then I think the second system would be the musculoskeletal system. You guys, anybody already take anatomy one? Is that the order? If you can remember, no, we blank out and no, we erased our memories of all the things anatomy. So we look at each system of the body. One thing that I spend a lot of time assessing is cognition, especially with our older adults, that ability to have good cognition. There could be specific impairments that we might want to measure: aerobic capacity, circulation, walking ability, different mobility ways, pain, cradle. I mean, on and on and on. We could talk about that. We'll talk about more of this stuff later on. Prognosis, we talked about a little bit. The plan of care. The plan of care will include which interventions that we can perform for that patient, duration, frequency. It also is going to include the goals. The goals are patient specific and they should be reasonable. Short-term goals typically look at the body part and making that better. Long-term goals look at the function. So if we go back to our ankle sprain, first thing is lots of swelling. Second thing is lots of pain. Third thing is limited range of motion and strength, right? So we would measure those things and we'd create a short-term goal for each of those. Improve range of motion by 30% might be my first goal. Improve manual muscle score by 1 grade might be my other goal. Resolve swelling to contralateral side would be another goal. Anybody want to take a shot what my long-term goals for that ankle sprain would be?
Try not to push yourself to create injury.
Yeah, good things to educate our patient on. Our goals would be a little bit more specific and most importantly, measurable. So walking a certain number of feet. You guys remember what strength tests did we do last week? We did one manual. We talked about manual muscle tests. And what was the other strength test we did in the hallway? The jumping, the 4-way hop test, right? All right. So my functional goal might be 4-way hop test to 10% difference right to left. That could be my functional, can they return to their sport goal? We talked a little bit about last week. It depends on what their sport is. Maybe a NFL, maybe a football lineman doesn't need, maybe they can have a bigger difference right to left, but a basketball player would need to be a lot closer. As we learn more about not only sport, but in your education, we'll be able to get more accurate with those goals. Could be just walking 500 feet. My patients in the home care setting, wherever I park my car, I measure the distance. How much distance is it going to take me to get from where I parked my car to their apartment or their house, whatever environment they're in. And that's the number of feet we got to get them to before I can discharge them. Like it's this person has to walk. How many people have short driveway? Their driveway is right next to their house. They have a short distance to walk from driveway to house. We have a few people. How many people? I go into some apartment buildings and they are so sprawling that patients need. I had one patient, she had to walk, I think it was 1,500 feet to get to her car, which in the home care world, that's an unheard of distance to say. But big sprawling apartment. It was an old mill apartment. Anybody ever been to those old mill apartments? They just go on forever and ever. Yeah, it was one of those. Anybody live in a place like that? Big sprawling place. So yeah, our goals for you guys are going to be very different just because of the environment, but we get to measure it, and that would be our long-term goal, right? Does that make sense to everybody? Short-term goal is basically body part. long-term goals is the function that we're trying to improve or return to. All right, so some factors that will influence whether we share a patient with a PTA. So I do the initial evaluation, I do the initial examination, I figure out the plan of care. Then I've got to figure out, is this patient good enough for my PTAs? There's a few factors to it. One, regulations, federal regulations. Two, our State Practice Act, that group of laws, right? So those are all legal things. The other things are practice setting, patient complexity, and then PTA experience and education. I think the practice setting, it's a lot easier for me to give a patient to a PTA when I'm working in an outpatient clinic because I'm 20 feet away. Like I'm working in the same building. That's really easy because I'm always here for advice to bounce ideas off of, or hey, Larry came in and he fell and sprained his wrist. I thought it was his ankle. It was his ankle. Now it's his wrist. Like I can jump in and help with that situation. In the home care setting, I'm not near that person. I'm away from them. So some of the practice settings can be a little tricky. The patient complexity definitely matters. I have a patient right now. He has ALS. He is declining quickly. And he is very different every time I see him. I don't feel comfortable giving a PTA. I have a few PTAs I do give patients to. I don't feel comfortable because that patient is so complicated that oftentimes I don't know what to do. So when somebody asks a question, hey, I'm really lost here, what do I do? I don't know either. But I'm not gonna put my PTAs in a bad spot. I'll take the I don't know and I'll figure something out, right? So patient complexity can matter. But with patient complexity, also the PTA experience and education. If my PTA was an expert in the neuromuscular world, they're better for this person with ALS than I am. So I would gladly delegate to a PTA if they have a unique skill set or their strength is something great. I had a PTA who was a dancer through college. Anytime I had to, dancers hurt themselves all the time. I don't know if you knew that, but anytime I'd have a dancer as a patient, I'd say, listen, I'll work with you today. Call me anytime you have a problem. You're going to go work with Lindsay because she's a real expert in exactly what you're talking about. So PTA experience can really make a difference. So PTAs can execute interventions, but communication is crucial for the patient's success. We communicate when things are going well. We communicate when things aren't going well, and we communicate when new problems arise. Communicate when things are going well. All it is just to check in. Everything's good with Larry. Ankle sprain is coming along, right? That we just need to check in. We're good. No problem. Great. It's obvious when things aren't going well how we would use that collaborative approach. Listen, his ankle it's been 2 weeks and it is no better. Okay. Let's go back. Let's look at this again. Maybe we missed something. Maybe there is a small fracture that wasn't picked up on the initial x-ray. Anybody have that happen to them? They take an initial x-ray. It doesn't, no, that wasn't broken. And then 3 weeks later, they say, oh, no, it was broken. That happened to you? Yeah. It happens often. And it's the way the bones heal. Like it's a lot easier to see some fractures. It's easier to see after because the fracture actually grows apart initially and then it grows back together. So anyway. So that happens a decent amount. When new problems arise, Talked about that plan of care. You have to operate within that plan of care. Day one, I might not get all the information I need to. It's not because I'm not working hard. It's just I didn't see something. That patient who sprained their ankle, they can't really walk on it. They're hobbling. I'm only going to ask them to walk from here to the table, get on the table. I purposely don't have the patient walk a lot because it hurts so much. Maybe once their ankle pain starts getting better, we realize, wow, this person has a huge balance problem. They are going to fall down left and right. Well, that's not something I was able to truly test on day one because of all of the other pain problems. So you might be saying, listen, the ankle pain's going well. The guy's balance is awful. We got to do something. All right, but we don't have balance within the plan of care so that you can't just add balance to them, right? So we've got to get them back to me for reevaluation to create a new problem in the plan of care, to new goals and new measurements, and then new interventions for that. So that's what happens when new problems arise. And that happens a decent amount. It's most of the time things are just going to go well. You guys are great, we're great, and the patient's going to do fine. Sometimes those new problems arise. So the minimal level of communication PTAs must practice in what's called general supervision. This is a definition you have to know. So again, if you've fallen asleep, wake up and underline general supervision. The definition of that is the PT is available via telecommunications during all treatment time. So I have PTAs seeing my patients during the day. When I'm teaching, my phone is on. I leave it on. Ask my wife not to text me all day long. But, because if my phone starts ringing, I think it's a PTA that needs something and I need to be available. I could go on vacation, have a PTA see all as long as I have my phone on me. I don't have to be anywhere near. I could be on vacation as long as I can answer that phone. I don't suggest doing that because then you're not really on vacation, but anyway. PTAs should have a supervision every 14 days, every 2 weeks. And that supervision, each state has its own practice act defines exactly what that is, whether it has to be in person or it can be out of not in person. But that is communication between the PT and the PTA. What are you doing? Where are they? What kind of intervention are you doing? How is this exercise going? Making sure that everything's going well. And then the patient has to be reevaluated once a month or every 10th treatment, whichever comes first. Additional communication when necessary. If the patient needs a reevaluation of any kind, reasons patient would need a reevaluation, either because their progress was so quick. Listen, I thought we were going to see this guy for 3 weeks. They're better now. We're done with them. Like, okay, great. Tell me, and I'll do that discharge evaluation for them. Lack of progress or the new problems, like we talked about. We gave a couple examples of. Help with problem solving, or when in the best interest of the patient. When in doubt, talk it out. More communication is always better than less, especially when we have new PTAs, not only new as in like new graduates, not a lot of experience, but also new just to the company. I hired a new PTA. She's great. She's got like 6 years of home care experience, but she and I talk every single day. because she started last week. She and I are talking with one another every single day. In November, it's going to be once a week, once every other week, or we're not going to have to. But right now, while she's getting used to everything, and we need to be a good team, we are talking every single day. So when in doubt, have that conversation. So the collaboration of PTs, PTAs, and aides. Now I'm going to be using the term technicians as aides, PT techs, just because later in the day I start to mumble. Maybe the audio recording isn't quite as clear. So oftentimes when I speak quickly and I say PT aides, sometimes we don't really wait. Does he mean PTA or PT tech? Right. So I try to use the term tech. So technicians can perform non-skilled aspects of treatment. Each state in their practice act, that those group of laws governing the profession, will clarify exactly what tasks can be delegated to a technician. In Rhode Island, techs can perform things like ultrasounds, therapeutic ultrasounds, applying modalities like hot packs, cold packs, and e-stims. Not every state is like that. Some states, they can only clean things in full towels. In Rhode Island, we get a lot more leeway. But regardless of the task, the PT aide has to be supervised with direct supervision. So this is another like definition you need to underline and score, or like make sure we know that. So that's where the supervising clinician is in line of sight as the task is being completed. So if that tech is demonstrating an exercise, if that tech is using an ultrasound, the supervising clinician has to be line of sight. That's not, hey, I'm going to take this guy in the back room to do something with him. Hey, I'm going to take the new patient in the private room so I can have a one-on-one talk. There has to, hey, I got to step outside to make a phone call. No, if the tech is working with a patient, their eyes have to be on that tech. No vacations allowed. No, just call me if something goes wrong. Student physical therapists and student physical therapist assistants. So, you know, as your student PTAs, you're going to be doing internships. Students require direct supervision, but students can also provide supervision to techs. So that's nice. Where did you get your tech job? Oh, okay. Which clinic? Oh, yeah. Nice. You live down that way? Oh, yeah. Yeah. I grew up in West Greenwich, right between Green and Richmond. Yeah. Yep. No. So, education of a PT, have to have a bachelor's degree, can be in any major. Like I said, I had a classmate, she was an art major. She just had the appropriate prerequisites. You guys are all taking prerequisites right now, right? You have to take anatomy, this class. What are the other prerequisites to apply to the PTA program? Communications, psych. Kines is a prereq? I don't think it's a requirement. Yeah. So as long as you have the appropriate prerequisites, you can then apply to graduate program of some kind. All PT education now is at the doctorate level. It wasn't always, but right now it's at the doctorate level. School must include didactic education. You guys know what didactic education is? That's what you guys are doing here right now. Lecture based, pointed at the board, make sure you learn this, kind of a lecture. But PTA education also has to have hands-on competency and a clinical education. So this is one of the reasons I think that physical therapy education is so difficult, because you have to be able to succeed in a lecture-based environment. You also have to succeed in a hands-on environment. There's lots of education that leans way more to hands-on. Education to be a plumber. If you wanted to be a master plumber, what is that process?
Really, the school doesn't matter so much, more the hours on the job.
Yeah, exactly. It's exactly. So apprentice, journeyman, then master, like it's hands-on. Like you
Smart like pay off your boss, 9 hours.
I'm easy. I'm recording this. You don't want to do that. Yeah, there's some careers that are way more hands-on than there are classroom and lecture based, right? There's others that are way more classroom and lecture based than hands-on. I think I don't know, maybe our computer engineering type people, like they just got to sit in the computer and they just got to do the thing. Like they don't have to. For us, we have to not only take the test about how do we walk with people, but we also need to teach people how to walk. Like it's both. I think that can be really challenging. So PTA education, it's an associate's degree, includes all those three components: didactic education, lecture based, like we said, hands-on competency, and clinical education. Because the PTA degree is at the associate's level and the PT degree is at the doctorate level, there's not an easy path to be a PTA and then become a PT. There are a few bridge programs that exist. So if you are a PTA, there's some programs that will say, okay, because what's the gap is that bachelor's program, right? That bachelor's degree. So if you can have a bachelor's degree in anything and then become a PTA, and then down the road you could become a PT because you have that bachelor's degree. But if you go to associates first, you got to fill that gap somehow. There are two bridge programs in the United States that exist that will give you a bachelor's degree and your doctorate degree all kind of in one swoop. New England Tech is developing a bridge program, and this should be up and running in I think 2 years. I just got advertisement. There's a lot of OT, masters in OT programs that offer a PTA to masters in OT bridge program. So I thought that was pretty cool too. All right, so some comparison of the two. Again, I'm a charts guy, so this is how I would, take two slides, make it into one chart. So you can look at that. This is so there has been debate over the recent years, last at least 15 to 20 years, increasing the PTA degree to the bachelor's level. One, it narrows the gap between doctorate level and associates, so our patients potentially benefit. But two, it provides an easier path for PTAs to PT. What do you think the downsides of it are though? Take longer to become a PTA. Yeah, and we'll get into some demographics in a little bit. I having taught in the PTA education for 10 years, I am against that. I think there's some ways it can be done well, but I'll show you why in a little bit. So employment settings for PT, private outpatient like a high bar, just under 32% of PTs are going to work in that type of setting. Hospital outpatient, 21%. So outpatient is over 50% of employment sector for us. Hospital, academic is like here, like teaching here. Home health, what's a SNF? SNF. Yep, nursing home, skilled nursing facility. And then school systems. My wife works in the school system. Average national salary, 89,000. Not bad. Employment of PTA, not as great of data for us, but private outpatient 45%, hospital outpatient 17%, inpatient hospital 8%. Don't have the rest of the numbers on the rest of the breakdown. So outpatient is the vast majority. Average salary 57, round up to 58,000. Now, one thing when we look at these numbers, there is a big difference in pay. What also is there a big difference when you look at their education? Doctor versus associates, but when we look at the pay, what comes along with getting a doctorate degree? All that student loans, right? So even though they get paid more, it also costs a heck of a lot more to get out there. The average debt for a PT student in 2022 is $100,000. The average. I know plenty of people that have way more than 100 grand of student loan debt. So you guys know what it costs to go CCRI, sign up for your first prerequisite class all the way through? I just looked at the numbers the other day. You guys know what it costs? I think it was just over $17,000 out the door for PTA. CCRI. At New England Tech, it's a lot more expensive. Since I left here, it's true. When I was there, it was pretty good, but I think there's some great people that work at New England Tech, and it's a very different program than what we've got at CCRI. I think the big difference is the students, not necessarily the professors. And I say that teaching in both programs. And I'm really proud of the work I did at New England Tech, and I'm really proud of the work I do at CCRI. It's the students that make it. It's you guys. It really is. So anyway, so yeah, just under 17,000 to out the door. Start day one. Where do I sign up for anatomy? All prereqs, both 2 years of the PTA program, 17 grand. 17 grand. How much do you think 17 grand costs you or will get you on this path? How many years for a bachelor degree would it get you? Yeah. Anybody know off the top of the head? You or I or Rick? You or I? That's probably 17 grand is probably a year and a half. I think it's probably 3 semesters. That's what my guess is. I'll look up those numbers later. Maybe next week we'll see. So anyway, like something we talk about as the profession whenever we talk with one another is the debt to income ratio. The debt to income ratio for PTA. We look at these numbers and say, wow, we're getting paid a lot less. Yeah, but the debt to income ratio is really favorable for the PTA versus the PT. Most of that extra money is going towards student loan payments per month. It is a big problem in our profession, and it will bite us in the ass in another 10 years because we're going to see dwindling enrollment, and that's not going to be a good thing. But I can go on about that for a while. So other demographics, PTs, 69% female. The biggest age bracket is between 30 and 34 years old. For PTA, 78% female. My PTA group right now is inverse of that. I got there day one and I'm in the lab and I'm looking around going, am I in the right place? This doesn't make sense. Like we are 2/3 male in the current group. It's very unusual. Anyway, biggest age bracket, 45 to 49 years old. Why do you think our PTAs in general are older than our PTs? go right into college as a 18-year-old and then go all the way through, get out at the age of, 24-ish and you start practicing. Yeah. What about PTA? Most people come right from high school? No. The average age of the PTA program is 28 years old. So most is a second career option. Most is I tried doing this and I just don't like this career. So let me switch into some. I thought I liked designing websites, but I actually hate sitting down all day long. I want something more active, right? So most of the time it's a second or third career option. Now, knowing this here, what if we were to think about changing the education to a bachelor's level instead of an associate's level? What do you think? I think there would be less and less PTAs. I think part of the draw is, man, in a few years I can be a PTA. I can do this. And especially at CCRI, I know your prereqs, there's a lot of them. The PTA program is 2 days a week for the first year, 3 days a week for the second year. So you can manage some work. Like you can do that. Yeah, why stop? Keep going, right? And especially when we talk about debt, 4 years of bachelor's level debt. Keep going, keep going. I'll at least make more. I'm already racking up debt. If we go to a bachelor's level, absolutely. The debt to income ratio is now way out of whack again. Yeah. So those are reasons why I'm against the schooling becoming at the bachelor's level. All right. All right, major abbreviations to know: past medical history, mechanism of injury or mechanism of illness, SCI, and traumatic brain injury. SCI, spinal cord injury, TBI, traumatic brain injury. Do we have any questions? Yep.
But your history, when you went to college and that you have to pay?
Yeah. I Rhode Island resident, stayed in Rhode Island for both undergrad and grad school. So had in-state tuition, which was really nice. The cost of URI from my freshman year to my graduating year in grad school doubled. So it was pretty affordable for my undergrad, and then grad school got really expensive. And I got the best teaching assistantship. They don't even offer it anymore. It was the best paying job I'll ever have. It paid for 12 credits of my undergrad degree. I did this teaching. I taught human physiology, and part of the contract was they pay 12 credits of your education. So delete that from the bill right off the bat. And they paid me way more. They paid me for 20 hours a week when I only had to work like 6 hours a week. It was pretty glorious. So yeah, I say I got lucky, and I did. I also worked my tail off to get that internship. So I got pretty lucky. My wife, on the other hand, opposite. She racked up every single piece of debt she could find. So yeah. So they do have internships. They rework the contract. It is not as the pay package is not nearly as generous as it is. Yeah. Yep. So, all right. That's the end of recording. We'll stop that.